Fourth heart sound. The fourth heart sound is a low-frequency sound heard just before the first heart sound, usually preceding this sound by a longer interval between the two components of the normal first sound. It has also been known as an atrial gallop, a presystolic gallop, and an S4 gallop. It is most commonly known as an S4. The S4 is a diastolic sound, which occurs during the late diastolic filling phase at the time when the atria contract. When the ventricles have a decreased compliance or are receiving an increased diastolic volume, they generate a low-frequency vibration, the S4. Some authorities believe the S4 may be normal in youth, but is seldom considered normal after the age of 20. The abnormal or pathological S4 is heard in primary myocardial disease, coronary artery disease, hypertension, and aortic and pulmonic stenosis. The S4 may have its origin in either the left or right heart. The S4 of left ventricular origin is best heard at the apex, with the patient supine or in the left lateral recumbent position. Its causes include severe hypertension, aortic stenosis, cardiomyopathies, and left ventricular myocardial infarctions. In association with ischemic heart disease, the S4 is often loudest during episodes of angina pectoris, or may occur early after an acute myocardial infarction, often becoming fainter as the patient improves. The S4 of right ventricular origin is best heard at the left lateral sternal border. It is usually accentuated with inspiration and may be due to pulmonary stenosis, pulmonary hypertension, or right ventricular myocardial infarction. Since the S4 is a low-frequency sound, it is best heard with the bell lightly held. Listen now to an S4. During the recording, the fourth sound will be removed and then added again. Now listen to an actual fourth heart sound, recorded from the apex of a 60-year-old male with cardiac disease. Now compare the timing and quality of the S4 with that of a split first sound. First, the S4. And now, the split first sound.